Dr. Uma Kumar, Founder Head, Department of Rheumatology at All India Institute of Medical Sciences, New Delhi. At the outset, I would like to thank the organizing committee of Apicon 2022 for organizing such a wonderful scientific feast, where I also had the opportunity to talk about connective tissue disease associated interstitial lung disease. As we all know, connective tissue diseases or autoimmune diseases per se are increasing over the period of time because of various lifestyle changes and environmental factors. And if connective tissue diseases are rheumatoid arthritis, systemic sclerosis, systemic lupus erythematosus, Sjögren syndrome, idiopathic inflammatory myositis, and mixed connective tissue diseases. And when we talk about interstitial lung disease or interstitial pneumonia, there is no separate classification for CTD-ILD. The classification, which is European Respiratory Society and American Thoracic Society 2013 classification, which is actually applied to CTD-ILDs also. If we look at the prevalence of CTD-ILD, it ranges somewhere between 10 to 15%, and on an average it's around 13%. And the most common connective tissue diseases which are associated with interstitial lung disease are found to be rheumatoid arthritis, Sjögren syndrome, and systemic sclerosis. And it's very important to detect interstitial lung disease early, because if we look at the treatment outcome, it's much better in CTD-ILDs than idiopathic interstitial lung disease or IPF. But not all CTD-ILDs are treated. There are certain criteria which are to be followed when we are deciding to treat CTD-ILD. But all patients of connective tissue diseases are to be screened for presence of interstitial lung disease with detailed clinical history and examination. Along with that, doing pulmonary function tests, we do 2D echo, or wherever required, high resolution CT chest. So if patient has symptoms and there is deranged pulmonary function, and on CT there are certain types of interstitial pneumonias. It could be UIP, which is usual interstitial pneumonia, NSIP, non-specific interstitial pneumonia, organizing pneumonia, or any other form of interstitial pneumonia. These patients are to be treated, and there are various drugs available which have shown efficacy in connective tissue disease associated interstitial lung disease. To name few, it's cyclophosphamide, Mycophenolate Mofetil, azathioprine. There are certain antifibrotic drugs like nintedanib and pirfenidone. So, and steroids also remain the mainstay of treatment in patients with connective tissue disease associated interstitial lung disease. All such patients who are treatment are to be monitored, and if there is worsening of symptoms in ILD patients, we need to exclude infection or other causes, and if it is indeed primary worsening of interstitial lung disease because of autoimmune etiology per se, then we need to change immunosuppression or switch various immunosuppressive agents depending upon many clinical factors and investigations. So, I would like to conclude by saying that it's very important to detect connective tissue disease associated interstitial lung disease early, so that the treatment can be started and the progression or complication related to CTD-ILD can be prevented or halted. Sometimes if these patients are picked up early, there could be complete resolution of interstitial pneumonia. Thank you. And also, let's meet in Ahmedabad in 2023, where this next EPICON is going to be held.